It's very intense because you see everything here. But as I would tell the first years after I finished my first year, you're not afraid of an emergency room anymore because anything can come through that door and you've seen it and you've done it. So certainly, although you get your degree at the end of medical school and you have an MD after your name, you're not really a physician until you do your residency. I grew up in the Midwest in Illinois, and I had gone to college out in Boston and then went to medical school out in California. Decided to move back more towards the middle of the country, and my sister was here for her college undergraduate work, and I looked into it and did a away rotation here, and everyone's very nice, and obviously WashU has a stellar reputation as well, so I decided that this is where I would get my training. Currently, I'm in the north suburbs of Chicago with a very large multi-specialty group. I do mainly private practice model, although I do have some involvement with University of Chicago residents, both in the clinical setting and in the operating room. When you're out as a real doctor, you need to know what you're doing. And the only way to do that is, well, there's a couple ways. One, experience. So there has to be the patients and the pathology and just something to see. If there's nothing to see, then you can't really truly learn it. Also, the faculty. You need to be surrounded by faculty who are willing to teach and have the expertise necessary so that you can actually know what the options are. Because everyone can learn the basics, but when it becomes difficult and you have to think through the options, that's what a place like WashU can offer. Enough pathology and with enough thought process so that you can determine what may be best for your patient. When you interview at different programs, there's different personalities to different residencies. Some are more research-oriented, some are more clinical-oriented. Some places, things are more on a hierarchical basis. Some are less so. And so the key is to talk to the residents and the faculty and everyone you can. I mean, even talk to administrative staff, and you want to know how the place feels because everyone's different. So what works for one person doesn't work for another person. So if you don't go in knowing yourself, you're working at a disadvantage.